Assalamu alaikum wa rahmatullahi wa barakatuhu. Nahmaduhu wa nusalli ala rasulihin kareem. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. لقد كان لكم في رسول الله أسوة حسنة لمن كان يرجو الله واليوم الآخر وذكر الله كثيرا. All praise is due to Allah subhanahu wa ta'ala, our nourisher, our sustainer, our creator, Almighty Allah, who has created the entire universe, created mankind, created jinnkind. And just like how we are from the creation of Almighty, He reminds us in the Quran, لَقَدْ خَلَقَنَا الْإِنسَانَ فِي أَحْسَنِ تَقْوِيمٍ, that we have fashioned man in the best of fashion. We are reminded in the Quran that Almighty Allah Ta'ala has shown us from the many of His great signs, but in our own selves, وَفِي أَنفُسِكُمْ أَفَلَا تُبْصِرُونَ. Look at our own self, look at yourself, and do you not ponder and reflect? Can you not see? Today's topic is so important, given that we all are concerned and worried about our life, our family, our wealth, our health. How many people generally are concerned naturally about our tendency to hold on to life, because life is very precious. And how, when a person he is overcome with some type of sickness, how does he feel in that condition? And yes, it needs to be pointed out that we are living at a time where we had witnessed and we had seen so many people, especially in the wake of the pandemic, how many people had lost their lives, how many people had become ill. So we have two very special guests, and reminding you, yes, the month of Rajab has commenced, and as we right now after the sunset, when we go into another day of this month of Rajab, it simply means that we have to pray and make dua that Almighty give us barakah in this month of Rajab, as well as Sha'ban. Allahumma barik lana fi Rajab wa Sha'ban wa ballighna Ramadan. And we pray and make dua that Almighty let us live to see the blessed month of Ramadan, the blessed month of fasting. Rajab and Sha'ban, these are only 2 months remaining for the month of fasting. With the month of fasting fast approaching, again, we would need to be concerned about how do we keep our fast in the day, how do we keep ourselves healthy, how do we cope. But with our guest, two very special guests, Brother Malik Gul and Dr. Agnelo Fernandes. But what we would like firstly is welcome to our guest to this very special reflections program. Very special today. Normally I'm all alone, just you and myself, the camera. But today, Jazakumullah khairan for Malik Gul. Firstly, could you give us a little background about yourself, and as well it would be nice for you to introduce our guest, Dr. Agnelo.
Thank you, and very pleased to be here. My name is Malik Gul. I work for the Wandsworth Community Empowerment Network, just across the border from where we are in Croydon, in Wandsworth, based in Battersea, but also work across southwest London. We're an independent charity, and we work very closely with the health services in relation to how do we improve access, outcomes, and experiences for our communities and their health and well-being. So we've been working very closely with GP leaders across southwest London, and I'm very pleased that I got to meet Dr. Agnelo Fernandes. And perhaps, Dr. Agnelo, you could say something about yourself.
Yes, I'm Agnelo Fernandes. I'm a GP in Croydon in Thornton Heath. I've been in the same practice at Parchmore Medical Centre for 32 years, and I'm the lead GP for Croydon for South West London CCG.
Amazing. When you just said that you are the lead GP here in Croydon, that is really amazing, because it brings to mind, Dr. Agnelo, you remind me of Dr. Krishan, who sadly had passed away. When this pandemic people had contracted the virus, sadly, I am, as a Muslim chaplain, at the St. George's Hospital, I had to visit many patients. But when it came to Dr. Krishan, because it was the beginning stage of the virus, and the health professionals themselves were not very clear on how to afford treatment for the patients, sadly he passed away. And the closest I got to him was just at the door outside, and I cannot even imagine how it was for his wife and also his children when he sadly passed away. But to deal with that, the challenges that we faced was not only about, concerned about our physical well-being. We felt that we had to actually help and support his wife, and the mental well-being of people who suffered during this period of time was really, really, really challenging. What is your reflection, especially with the virus itself? We are now in Omicron. When are we going to, I don't want to say Delta Cron, but what can you tell us right now? What is happening? Because it seems like people right now are feeling much more relaxed, or given that restrictions, it's been lifted. And also, can you tell us a little bit about Dr. Krishan?
Yeah, so Krish Arora, as we know him, was a colleague of ours for many decades in Croydon. So his illness and his death was a real shock to everybody. And it affected everyone, so all the GPs in Croydon, because it suddenly realised that you were vulnerable, and it could be you, and you had a job to do. You had to look after the people that you're tasked with looking after, your patients. So every day, GPs thought about, could it be me? And that concern was something that we lived with all along, and having been in contact with his wife during that time of his illness, the impact in that personal relationship and his family was really very strong, the feeling of, where is this all going to go to? So it was very sad and very tragic, but it had ramifications for all the GPs in Croydon, because a number of them were ill, a number of them were in hospital. But it was a difficult time.
Yes, indeed.
But from that difficult time, we've gone through different waves of COVID, and we're now with Omicron, which is, although much less severe in terms of symptoms, is still an illness that can be severe enough for people to end up in hospital and even die.
Yes.
And those that have been vaccinated and had the booster are less likely to end up in hospital. And we're seeing that already. And it's because of the vaccination that we're in the position we're in now, where the Omicron is still there, but is not causing as much damage and as much harm to many more people. And numbers of people going into hospital are less than they were before.
Yes, so just one more point on this. I have a friend, Imam, from the New Crescent Society. He's been suffering from long COVID. And what would you advise as a GP? Here is a person, he's exhausted, he's fatigued, he says he hasn't recovered. And what is this long COVID?
So when people think of COVID, they only think about the hospital and the wards and intensive care. But you recover from that, and some people end up having multiple symptoms. Tiredness is one of them. Breathing problems is another. Obviously, the loss of smell and taste was another, very strong with the previous variants as well. And what COVID does, it's not just like the flu. It affects all parts of your body, your heart, your liver, your lungs, your kidneys. It makes you feel tired for a lot longer than ever before. And it affects your mental health. So important to get as protected as we can be with being vaccinated, being able to take the precautions that we should be taking to prevent getting the illness in the first place. So the only good news is that you'll be ill for a long time, and how long we don't know with long COVID, but things will get better. And that's the hope in the system, is that it will get better.
All right. So, coming to Malik Gul, I mean, here we are only discussing about COVID. Unhealthy Britain, nation's 5 big killers. What is your understanding of, obviously as a GP, we are dealing with patients. Everybody's mind is focused on the coronavirus and how to protect ourselves, how to save lives. But now we are learning something, that there are other different nation's big killers. Would you like to add a point on this?
Yeah, can I go back a little bit?
Okay, yes.
Yeah. Health inequalities exist.
Okay.
The data, the information, the evidence that we have is that there's certain communities who are overrepresented with certain diseases. So I'll give you an example, diabetes.
Okay.
You're more likely, if you're from a South Asian community, to be impacted by diabetes than any other community. Hypertension, for example, if you're from a black African community, a male, you're more likely to be impacted by hypertension. Another example, mental health. If you're from a black minority ethnic community, our own Muslim community, you're much more likely to be overrepresented in hospitals than if you're from the host community. So, Sheikh Suliman, these are things that we knew, and these are things that we known. What COVID exposed was these health inequalities at a greater scale. For example, if you were from a BME community, you were more likely to be impacted by the disease than other communities, particularly Bangladeshi communities, to be honest with you, and also some other kind of minority ethnic communities. What was surprising for me, working with the NHS, is that the NHS was surprised that these inequalities exist. So what began there is, and this is how I got to meet Dr. Agnelo, is Dr. Agnelo and other GPs then started to have a raising awareness campaign for people to come and get the vaccination. Perhaps, Dr. Agnelo, you can talk a little bit about how that work started and the kind of campaigns that you ran.
So that's where we met for the first time. And we realized that as a health service, as a system, we were not reaching the population that we thought we were. Whereas faith leaders like yourself and Muslim leaders and people in mosques had a far greater reach to get messages across to people because you're trusted. And the vaccination element of it, as I said, is the reason why we are coming out of the pandemic in this country and overcoming it. And having your voice added to the health, the NHS, in terms of trying to help people keep themselves safe, but also protect them. And I think that is the start of that conversation, the realization that actually the NHS hasn't got all the answers. And whereas people like you in the positions that you're in have got the answers to be able to try and help people and give them the right messages.
So adding on this point on elderly Muslims have greater health concerns. Now, how old are you, Malik? Over 50?
I am over 50, yeah. I am over 50.
So you fall under the elderly Muslim group?
I think I do. I do.
Any health concerns?
I do have health concerns. But what's really interesting about starting the conversation around COVID is that those campaigns were relatively successful because people like yourself and other leaders in our community, whether they're imams or management committee for mosque or black church leaders, they also helped in getting the information out. And what we discovered through that process is why just stop at COVID? Because back to your earlier question, our communities are also impacted by heart disease, by liver disease, by cancer, by dementia, by Alzheimer's. And also within our communities, we are less likely to go to a GP than other communities.
I just want to add one point on this. You know, when you're speaking about all the other health issues, as an Imam, we are contacted with people in the community, and it is all about the mental health. You know, as we learned that mental health is also something very important, but there is a Muslim type of healing, and that normally we used from the Quran. So what I've realized is there are certain matters which the community out there suffering. Even during this pandemic, they were isolated. Many were, during lockdown, the proportion of people suffering from mental illness also increased, the percentage of the people. So, and we also found that there were issues with many of the marriages. People suffered during this lockdown period. So now, here is other killers, but we focus on generally, you said liver disease and diabetes and hypertension. But what about mental health? How are we going to deal and cope with this issue in the community?
Well, my view, and I'm sure Dr. Agnelo has a view, and I think we have similar views, is that actually, by the time you come into your GP, and by the time you come to the hospital, sometimes it's actually too late already.
Okay.
That you've already got early onset of poor mental health, of psychosis. Too late in terms of it becomes more difficult to manage. And what we think that's important is that you have to get in early, quicker and sooner. So when people are feeling anxious, depressed, maybe not sleeping well, you mentioned difficulties in the family, maybe difficulties with children. This is when the first early signs of mental disturbance comes in. So you've got to use the places where people already associate. People go to the masjid, people go to the church, people go to the community centre. And
people don't go to the GPs?
Well, they do, but quite often they go to the GPs after things have gone bad. Perhaps, Dr. Agnelo, you can comment on that.
Absolutely.
Okay.
We think that everyone just comes to GPs, but it is at a stage much further down the line.
Right.
So if we could go back a step or several steps where people don't even realise they've got a mental problem, they just know they're not well. And if they can talk to somebody well before that, and usually it's not the GP that's the first person they talk to.
But the issue is, nobody's going to come to speak to an Imam if they know Imam is not qualified. So how do we deal?
Well, there's a few things. Okay. As you know, Sheikh Suliman, you're qualified as a family practitioner. And I think part of what we want to do is two things. Part of what we want to do is give local people like yourself, Imam, bishops in churches, the kind of basic training and understanding, obviously not at the clinical level or the kind of senior level, because that's not your job as an Imam or the bishop, but to have a really good understanding around mental health issues, around health issues. So therefore, when people come to you, you'll be able to provide them with the first stage of the information. The next thing we want to do is, can we then bring clinicians into the masjid? Can we get healthcare professionals to come to the masjid, so people can come to the masjid and see you as the Imam and also go to the prayer hall, but they can also get their blood pressure checked. They can also get their cholesterol tested. They can also know about diabetes and know their risk about diabetes. Very importantly, they can get their weight done and their waist done. And from the masjid at an early stage, they can get a diagnosis and an assessment. So you can put people onto good health programs much, much earlier and sooner through the masjid. As opposed to, these things are going on in their life, Imam is not equipped, masjid is not equipped, church is not equipped, things are getting worse, and only at a late stage they then go to the GP. By that time, it often becomes very difficult to manage their health conditions.
Generally, the role of the Imam is to give spiritual boosters. You're speaking about getting another jab, so we're giving all the time, like Friday is the day we give a boost, but it is more spirituality. So it makes sense, because now we want people to, part of our faith is people need to worship the Lord and the Creator. As the Lord Almighty says, I have not created man and jinn save that they worship me. So ibadah, worship, in order to worship the Creator, if I am suffering from a type of illness, it does affect a person's capability on how to offer his prayer and how to worship. And then if people get impacted with the mental health. So I think this is something that you have really pointed out, that how we can use our mosques and different communities where the people come together and also deliver a talk on, as Ramadan is fast approaching, like keeping the fast. Now there's benefits of keeping the fast, but then at the same time, it seems most of the sicknesses and illnesses that we are suffering is from our lifestyle. So even as an Imam, I need to lose weight, but now I have to go to get some professional.
Can I say that's really important, and I know Dr. Agnelo will have a view on this as well. For the first time in the history of humanity, the biggest killer of people in the West is not infectious diseases. 100 years ago, people were dying of things like smallpox, or in our own countries, malaria, typhoid, and there still are. For the first time now, the biggest killer of people in the Western world is exactly what you said, lifestyle diseases. And these lifestyle diseases are almost entirely preventable. Perhaps you can talk about the lifestyle diseases.
Yes, that would be really good.
So the obvious ones are obviously diet, exercise, relaxation, and these are all things that are important to have a healthy lifestyle. We don't realise the diets that we have. We have a diet high in carbohydrate, high in sugars. And weight gain is easy. Exercise is a part of it, but we don't always do it, myself included. We're all guilty. But the society and the system that we live in kind of makes us move in the wrong direction. And so we need to turn that back, and we need to be able to try and get people thinking about healthy living as something they do naturally without being told.
Yes.
And some of those messages come from birth in your own family. So children in families don't often get the right advice because their parents don't know what advice to give them.
Okay.
So that the messages getting through are intergenerational, and that is an opportunity that we have in terms of people come for their spiritual help and their spiritual well-being.
Yes, indeed. And with this, we will go for a short break, and hopefully you will join us after the break as we continue to discussing inequalities in health, especially among the community BME.
Black, minority, ethnic.
Yes, so after the break, keep watching. Assalamu alaikum wa rahmatullah.
There's a